In some other news tonight, Washington and local communities are gearing up for the possibility of a more severe H1N1 flu outbreak this fall. The Obama administration announced today a vaccine for the flu could be ready by October. School-age children would be among the first to get the vaccine. President Obama says the government could pay for them. Health officials say they are focusing on children because they seem to be the most likely to get the virus.
Since the population that seems to be most affected is younger folks, school-age kids, kids in daycare centers, we may well partner with the schools looking at those as possible sites for a vaccination program.
According to the Centers for Disease Control, nearly 34,000 people across the country have contracted H1N1. And with so many people contracting the virus, health officials on the local level are also planning for an outbreak.
And it's not uncommon to have situations like this where the flu comes in the spring and then comes back again the next fall. Health workers have been meeting in Appleton over the last couple of days to discuss their preparations. They expect the virus to return when the school doors reopen. Fox 11's Lindsay Veramis has more.
School may be out, but the threat of an H1N1 outbreak is in the minds of administrators.
Health is always a focus. If we don't have healthy students, we don't have students that can be academically successful, and if we don't have healthy staffs, we can't have staffs that can impart curriculum to our students.
Yvette Dunlap with the Appleton School District says, like those in Washington, leaders here continue to monitor the virus. But they believe the strain and situation could change again before doors open in several weeks.
What we saw over the springtime could be quite different in the fall, and that's the unpredictability of it and why we just have to remain flexible.
Despite a perceived lull, Health Director Kurt Egebrecht says the virus never left.
Oh, it's not gone.
His department is still seeing cases of H1N1 and could see more come fall.
Children are very good conduits of illnesses, and so when they get back into the school building, you have a greater likelihood of disease spread.
But parents out at the pool had few concerns.
I don't think it's any worse than influenza, and we've all made it through that.
We take the usual precautions for hygiene and safety, and I don't get too worked up about it.
While national leaders are still bracing for problems, an H1N1 vaccination could be ready for students this fall. Yet the Department of Health and Human Services says there has been no decision on whether to vaccinate Americans. The vaccine is still being tested for safety, but schools and some parents are hopeful.
I would do the swine flu vaccine if it was available. But
don't expect the vaccine on mandated immunization lists like measles, mumps, and polio. Health workers say strains of this virus change too frequently. In Appleton, Lindsay Veramis, Fox 11 News.
The World Health Organization declared the H1N1